881. Patient is feeling hand numbness. Which medication should they receive? A. Vitamin C. B. Vitamin K. C. B12. D. Folic acid. The answer is C. B12. 882. Post-limb amputation pain. A. Phantom. B. Radiating. C. Shooting. The answer is A. Phantom. 883. Mother of 9 children, 3 of them with congenital anomalies Down syndrome. She is a primary school graduate, with low status. She is not using any method of family planning. According primary healthcare nurse referred her for counseling. Which of the following types of home visits that the community her nurse should conduct for this client? A. Systematic routine. B. Selective. C. Follow-up. D. Field trip. The answer is C. Follow-up. 884. A coworker informs that the nurse about experiencing increased level of stress associated with daily responsibilities. To help cope with professional stress, the nurse should encourage the coworker to A. Make a list of unfinished tasks. B. Complete complex mental task before physical tasks. C. Acknowledge daily accomplishments. D. Spend time with colleague away from work. The answer is A. Make a list of unfinished tasks. 885. What refers to actions that promote the well-being of others? The nurse who is exemplifying it takes positive actions to help clients. The answer is beneficence. 886. After testicle removal, what should the client avoid? The answer is heavy lifting. 887. How is the Weber test done? By placing a 512 vibrating tuning fork on the patient forehead midline, where you can hear a buzzing noise. The answer is Weber test. 888. According to Ramsey sedation scale, the patient is in ICU on sedation and on assessment. Patient is in deep sleep and no response to light. What is the score on Ramsey sedation scale? A. 2. B. A 3. The answer is B. 3. 889. A 62-year-old woman admitted to the emergency department for the 4th time this year. Each time the patient comes with severe injuries and bruises in the body. What is your responsibility as a nurse to prevent such incident to happen again? A. Reports the assault to the local police and write a report. B. Provides information about safe shelter and support. C. Instructs the women to move away from her home. D. Discharge the patient to a safe shelter. The answer is A. Reports the assault to the local police and write a report. 890. After rectal surgery, what bath type? The answer is sitz bath. 891. Mother came to ER with child diagnosed with rheumatic fever. The nurse should ask the mother if there is family members has A. Congenital heart disease. B. Recently have tonsillitis. The answer is B. Recently have tonsillitis. 892. A 45 years old with severe upper GI bleeding is admitted to the medical ward. The doctor orders the nurse to give the patient blood transfusion. Which peripheral forecatheter gauge is best for this procedure? A. 14 gauge. B. 16 gauge. C. 20 gauge. D. 24 gauge. The answer is B. 16 gauge. 893. Which of the following religion is prohibited the blood transfusion? A. Christian. B. Muslims. C. Jewish. D. Jehovah. The answer is D. Jehovah. 894. A nurse is caring for a client who is having an allergic reaction febrile, flushed with the first nursing action. A. Stop blood transfusion immediately. B. Replace the blood with saline. C. Administer an antihistamine. D. Place the client flat with the feet elevated. The answer is A. Stop blood transfusion immediately. 895. The nurse is monitoring a client receiving a blood transfusion after 30 minutes when the client develops a cough with shortness of breath. The client also complains of a headache and a racing heart. What should the nurse do first? A. Stop transfusion immediately. B. Replace the blood with saline. C. Administer an antihistamine. D. Slow the infusion rate. Important notes: if reaction happened within the first 15 minutes. Stop blood transfusion immediately. If reaction happened after 15 minutes. Slow infusion rate, first cause of overload, then inform the physician. The answer is D. Slow the infusion rate. 896. During a patient's blood transfusion, which of the following are associated with an allergic reaction? The nurse should recognize that. A. Diarrhea and rapid onset of chills. B. Itching and asthmatic wheezing. C. Low back pain and acute renal failure. D. Distended neck veins and a rise in venous pressure. The answer is B. Itching and asthmatic wheezing. 897. A nurse is assigned to care for a 32-year-old glomerulonephritis. The nurse is transcribing patient file. Which of the following orders should the nurse clarify? A. Bed rest. B. Daily weights. C. Strict intake and output check. D. Frequent blood pressure check. The answer is A. Bed rest. 898. When is the best time to collect urine specimen for routine urinalysis and culture and sensitivity? A. Early morning. B. Later afternoon. C. Midnight. D. Before breakfast. The answer is A. Early morning. 899. The nurse is assigned to care for a patient with Paget's disease, complaining of bone pain. Which of the following conditions is this patient high risk for? A. Hypomagnesemia. B. A hypernatremia. C. Hypercalcemia. D. Hyperkalemia. The answer is C. Hypercalcemia. 900. Mother came to ER with rheumatic fever baby. What should the nurse ask the mother about? A. If there is any member family has congenital heart disease. B. If he recently had tonsillitis. The answer is B. If he recently had tonsillitis.